Good evening to all. Today's topic is head and neck cancer. As we know, the incidence of head and neck cancer in India is very high. If we divided the head and neck cancer, that is lip and oral cavity cancer is the highest. That is about 60% of the cancer, head and neck cancer is lip and oral cavity cancer. Incidence of new cases for head and lip and oral cavity cancer is around 1 lakh 19,000 approximately. The number of death was 72,600 and 5 years prevalence about 2,65,000. The next common head and neck cancer is the laryngeal cancer. It is about 14.5% incidence of new cancer and number of deaths about 15% of total head and neck cancer, and 5-year prevalence 15.5%. Then after that, oropharyngeal cancer, that is around 9.1% new cases incidence and number of death 12.7%, and 5 years prevalence was 10.2%. Hypopharyngeal cancer, incidence of new cases around 13.1% of all head and neck cancer, that is around 25,947 cases of new cases, and number of death around 8,800, and 5-year prevalence was 34,081. So on this table, we can say that there is a huge burden of head and neck cancer in India. In India, about 9 cases per 1 lakh population is head and neck cancer. And nasopharyngeal cancer is highest in our Northeast India, that is in Nagaland. If we see the Globocon data of 2020, head and neck cancer, that is lip and oral cavity cancer, is the second most cancer after breast cancer, that is 10.3%. Head and neck cancer, head and neck region we can divide into different parts. Like as I have already told, the different incidence of head and neck cancer, that we can divide it into oral cavity and lip cancer. We can divide into nasopharyngeal cancer, then oropharyngeal cancer, and hypopharyngeal cancer. What are the risk factors for head and neck cancer? Alcohol use and tobacco. These are the two most common cause of head and neck cancer. Apart from alcohol and tobacco, other cancers are viral infection, and some other risk factor. So smoking, it may be in the form of cigarette smoking, hookah smoking, snuff, and hopefully it may be other form like oral ingestion of tobacco like gutka, zarda, and kani. And other risk factor for head and neck cancer is viral infection. Most common viral infection is human papillomavirus, followed by Epstein-Barr virus and herpes simplex virus. These are the different infection causing the head and neck cancer. The symptoms of head and neck cancer is depending on the stage of head and neck cancer. It has the different symptoms. Patient may have the white patches in oral mucosa. Patient may have lump in the mucosa. This is the lump in mucosa. Patient may have the neck mass, that neck swelling. Or patient have the blood-stained nasal discharges. It may be due to the nasopharyngeal cancer or any other sinonasal cancer. Patient may have diplopia or double vision, that means due to the cranial nerve involvement. Patient may have unilateral headache. Other symptoms are persistent sore throat, globus pharyngeus, and ear pain, that is otalgia. Patient may have difficulty in swallowing due to the oropharyngeal involvement or the hypopharyngeal involvement. Patient may have long-lasting sore throat, as I have already told, due to the involvement of the palate or the pharyngeal wall. These are the pictures showing the red and white patches in the lip due to the lip carcinoma of the lip, and patient may have lump in the neck, that is due to the lymph node involvement. Weight loss also the another one symptoms for head and neck cancer. Patient may have persistent dysphagia and hoarseness of voice. These are the precancerous condition for the head and neck cancer. Leukoplakia and erythroplakia. These are the two most common precancerous condition for the head and neck cancer. Erythroplakia is the redness of the oral cavity mucosa, and leukoplakia is the whitish patches over the oral mucosa. This is due to the precancerous condition due to persistent exposure of the toxin like smoking and alcohol. Siderophrenic dysphagia or Palmer-Pinson syndrome, that is due to the iron deficiency anemia. This is another precancerous condition of the oropharynx. And this is the picture showing the submucosal fibrosis due to persistent use of tobacco. This is the proliferative verrucous leukoplakia spreading over the hard palate and alveolar ridges. This is the leukoplakia. This is white patches. And this is the oral hairy leukoplakia over the tongue. These are the precancerous condition. Workup and diagnosis. Physical examination and history is the most important point for diagnosis of head and neck cancer. Head and neck and mirror examination is the it may be the mirror simple mirror examination or the fibroscopic mirror examination. This is the most important point for diagnosis of head and neck cancer. Apart from that, we need the imaging like ultrasound and CT scan. We need the biopsy from the primary site. Apart from primary site, we have to do the FNAC or FNAC from the neck node also from the metastatic site. We need, when we suspect head and neck cancer, we have to do the human papillomavirus testing by immunohistochemistry, mainly for the oropharyngeal cancer. Epstein-Barr virus testing and nasopharyngoscopy also required for nasopharyngeal cancer. We may need the PET scan or PET CT when needed. Otherwise, we need the CT scan, HPV testing, dental and postdentatic evaluation to see the condition of the alveolar and gum. We need the nutritional status, speech and swallowing evaluation, and hearing and vision testing also required. Smoking treatment and cessation of smoking counseling are also the very most important for treating a head and neck cancer. And fertility counseling if needed, and multidisciplinary consultation is required for treatment of head and neck cancer. HPV testing like HPV E6 and E7, mRNA detection by the reverse transcriptase polymerase reaction, that is RT-PCR, is we can do the HPV testing, or we can do the P16 by detecting at the biopsy by IHC. And for high risk patient, we can do HPV DNA by FIS. That is the gold standard for oropharyngeal cancer for HPV DNA testing. And we need the FNAC and histopathology for diagnosis. This is about the contrast CT. We have to evaluate properly for staging workup. So we need the contrasticity, we need PET scan. Initially, PET scan is not required for diagnosis, but to see the staging workup or when there is a suspected residual or recurrence disease, we need the PET scan. We need to see the detection of occult primaries in malignancy of unknown origin or occult metastatic disease in the neck and synchronous primaries or metastasis. For that, we need the PET scan. This is the panoramic X-ray, dental X-ray. This X-ray captured the image of entire mouth, jaw, entire teeth, and several bones contain the head and neck and under anatomical structure in this region. So this is also very much important for staging workup of head and neck cancer. Nasopharyngoscopy is also essential for the nasopharyngeal cancer. Now the staging of head and neck cancer. We have stage 0 to stage 4. Stage 0 is the very early stage of disease and stage 4 is the advanced stage of disease. Stage 0 means that cancer is present, but cancer cell does not crosses the lining of the mouth or oropharyngeal cancer. This is also called cancer in situ. It does not crosses the mesenchymal membrane of the cell. Stage 1 is the visible tumor, that is tumor size is less than 2 centimeter and depth is 5 millimeter or less. In stage 2, tumor size is 2 to 4 centimeter without involvement of the lymph node. When there is involvement of the lymph node, that is the stage 3 tumor. And stage 4 tumor, it is stage 4 early and stage 4 advanced. In stage 4 early stage of tumor, there is involvement of the neighboring structures like base of the skull, then paranasal sinuses, then the jawbone. That is for the stage 4A, and stage 4B is involvement of the other structures like lymph node and other bone also, and stage 4C is the metastasis to the distant organ like spreading to the liver, lung or brain. This is the stage 4C. This is the very advanced stage of tumor. Now the treatment of head and neck cancer, primary treatment is surgery. When there is an early stage cancer or localized cancer, surgery is the treatment of choice. When there is an advanced stage of tumor, we need to do the adjuvant radiotherapy, or we can do directly the radiation for other head and neck cancer. Chemotherapy mainly used in advanced stage of cancer, mainly stage 3, stage 4 cancer. And nowadays we can, there is a newer therapy called immunotherapy we can use in head and neck cancer. The main immunotherapy nowadays used in head and neck cancer is nivolumab and pembrolizumab. How can we prevent head and neck cancer? First of all, we have to avoid or we have to stop the risk factor, that is avoidance of tobacco, avoidance of alcohol, avoidance of HPV infection, limit exposure to the ultraviolet light, maintain the healthy weight and eating pattern, and HPV vaccination. For the prevention for the tobacco, we have to pressurize to ban the advertising of tobacco product. We have to avoid the glorification of the tobacco product through the advertisement. Then we have to stop the use of all tobacco products. We have to increase the cost of these products so that so that very difficult to get such type of product. We have to ensure the adequate legislation. We have to educate all this about our young school children. We have to discuss about the marijuana and its risk factor and uses. About alcohol, we have to avoid alcohol or limit the use of alcohol, or we have to ban the alcohol if we get rid of from the head and neck cancer. Regarding HPV, getting HPV vaccine is the most important factor to prevent the HPV infection. Consistently using barrier methods such as condom and dental dam and during sex, and limiting the number of sexual partners is the most important factor for prevention of HPV infection. Apart from this prevention, early detection is the very most important. Self-examination and other technique like biopsy and exfoliative cytology is the very most important for detection of early head and neck cancer. We have to avoid the radiation exposure. We can use sunscreen, including lip balm with adequate sun protection factor, and dental checkup also very much important for prevention of early head and neck cancer. Thank you.